Parkinson's is a disorder which affects both young and old adults. So it is characterized by tremors which are predominantly at rest, slowness or bradykinesia, rigidity and postural instability. Usually it starts on one side of the body, either the right or the left, and within a couple of years it can involve the other half of the body as well. So this results in a lot of disability for the patient because of the slowness and the difficulty in walking. Parkinson's, when evaluated by the neurologist and started on treatment, idiopathic Parkinson's disease has an excellent prognosis. Generally, the first 5 to 6 years, one can control all the symptoms of the disorder with just medications. A little while later, beyond 5 to 7 years, many patients experience what is known as on-off or motor fluctuations. So the effect of the medicine suddenly wears off, leaving the patient rigid and unable to walk. This can sometimes cause a lot of embarrassment, especially when one is in a social occasion. And also for people who are working, it creates a lot of difficulty in between meetings and other such things. So there is an advanced treatment for Parkinson's known as deep brain stimulation. So those people who are still very responsive to dopamine therapy or the medical therapy do very well with deep brain stimulation. Prior to deep brain stimulation, the neurologist does a test called a Dopa Challenge test, where a dose of dopamine is given to a patient who is off medications, and the improvement in the scores, what we call Unified Parkinson's Disease Rating Scale, is taken. And if there's a significant improvement, the patient is a good candidate for deep brain stimulation. Deep brain stimulation is a surgical procedure which is performed by a trained movement disorder neurosurgeon, such as we have in Apollo Hospital Sheshadripuram, Dr. Ravi Mohan Rao, who is the head of neurosciences and also has been having more than 25 years of experience in deep brain stimulation therapy. So in deep brain stimulation, what is done is a tiny electrode or a wire is introduced, minimally invasive with a stereotactic frame, into a particular target. Usually it is the subthalamic nucleus, but other targets are also used in certain conditions, certain types of Parkinson's, such as globus pallidus, pars interna. So the patient is awake during the procedure, and an assessment is carried out by the neurologist who is trained in movement disorders to know at what point of time and at what strength of stimulation the patient responds well from an off stage. So that would determine where the lead should be placed. Typically, after placement of the deep brain stimulation leads, the patient gets discharged after a couple of days, and with programming and optimization of medication can have a very good improvement in quality of life. And this improvement continues despite progression of Parkinson's. So we have a very good therapy, both medical as well as surgical, such as deep brain stimulation, available for people who are suffering from Parkinson's disease at Apollo Hospital Sheshadripuram.